United Workers launched our Right to Health campaign at Maryland's Potter's Field, where the poor whose loved ones can't afford a funeral are laid to rest. We gathered our members from across the state to honor and remember those lost to poverty, a crisis that continues to claim lives in one of the richest states in the richest country in history.
Today, nearly 40% of Maryland residents struggle to meet their basic needs of housing, food, health care, transportation, and childcare.
This is not unique to Maryland. Across the country, poverty is deepening, made worse by post-pandemic cuts to vital public programs during the Biden administration.
This war on the poor shows no signs of letting up. The Trump administration and Congress just passed their terrible budget that represents the largest cuts to health care in history, along with reductions in food provisions and housing assistance, while giving the rich tax cuts. The rich want us to think we are not worth anything but starvation, eviction, and sickness.
We are because we believe in people's human rights, we believe in the right to health, and we are here to organize. The only way out of this is to organize.
We must build organization and a larger national and international movement to demand our right to live.
Learning about the conditions people are facing in rural Maryland, in Baltimore. There's differences in the particulars, but there's so much in common, and we're fighting the same fight.
We are demanding answers from all power holders. In Cumberland, we are calling for a town hall so that federal legislators can listen and learn. Members being denied health care cancer screenings by insurance companies. Politicians making it illegal to eat in a public park or sleep in your car when you have nowhere else to go.
The City of Cumberland has passed laws that impose jail time and fines up to thousands of dollars for sleeping, eating, or storing belongings in a car parked on public property. These are fines and jail time for being homeless.
Cumberland has been in the process of trying to recover from that recession since basically the 80s. And the poor are not to be blamed for this situation and not to be criminalized because it is not their fault.
I work 2 jobs, he works 1 job, plus my mom lives with us on her Social Security. And there are times with the bills, car payments, insurance, I'm paying off a lawyer right now because I had to get a lawyer to fight because I was driving without insurance because I couldn't afford it. The struggle is real. We're here with you. Anybody who is struggling, many of us have been where you're at now.
In Westminster, we are taking slumlord housing conditions that are sending our kids to the hospital because they can't breathe.
There's a lot of black mold and roaches and mice. And the landlord don't want to do nothing about it.
I found mold in my house, in my kitchen. They've wiped it out. They've measured my cabinets, so they didn't want to change my cabinets. I haven't got it changed. I recently got a doctor's letter saying that my son couldn't be in the house with any carpet, any pets, because of how bad his asthma is and how he ends up with oxygen. I turned the letter into the landlord, and haven't heard anything since.
My husband got sick due to heart problems. Part of it was from living here because of the mold issues. Then we got evicted when my husband was still in the hospital from having a stroke. It's not fair to have to put up with medical issues every day and then have to deal with slimy landlords on top of it.
And in Baltimore, Medicaid and food stamp cuts continue to take a heavy toll.
So you're a driver for Amazon, or we're living in your car.
Yeah, I would go into work at 4 a.m. And then, so that was cool. But sometimes I was just sleeping outside because, you know, if you're in uniform, no one's really kind of looking at like you're doing anything suspicious.
This starts with making the invisible struggle we go through, whether in the city, suburbs, or the rural communities, visible. We are all trying to survive, no matter where we come from.
Because this is not a Cumberland thing. This is not a Maryland thing. This is happening across the country. But we know a solution. The solution is that we need to do what?
Organize!
We need to organize.
Nobody is alone in United Workers. We are breaking our isolation, building the unity of the poor across the rural and urban divides of Maryland.
The time is now for us to unite as a class and build the power we need to demand our right to health. Join us.